Thank you for tuning in. We're here in Boca Raton today. I'm very happy to be with Dr. Roy, and we have a lot of very good information for you, so stay tuned. If you see the follow button, please press that so you can follow us, and whenever we're live, you'll be notified. So I'm here to introduce Dr. Roy for very, very special reasons, because she's an expert. And not only is she a physician expert, but she's also a trainer. And she's also an author, which I just found out about, a book that's about to launch. So I'm very excited to tell you about her sexual potential. Do you know your sexual potential? Do you know yours? Anyway, so we're going to get into what I've just heard in Las Vegas at the Aesthetic Show, which was quite interesting. 3 days of Dr. Allenside and all the famous doctors from all over the world talking about women's sexual health, men's sexual health, and how do we add these new profit centers to our practice? Well, Dr. Roy has done that very successfully here in Boca Raton, and we're live at her office, which is just absolutely beautiful, great personality, and that also helps. Remember, you always have to smile, and your patient is always right, and we have to always be in a good mood. So how do we add these new profit centers? And how do we look for these target markets and these niche markets in our area? How do we know what's right for us? Well, as consultants, we get asked those questions every day of the week. How do I know? Do I deal with the men's market, the women's market, women and men's sexual wellness and sexual health? How do we start the conversation? Well, there's a lot to that, and we'll cover a lot of it today, but we'll follow up next week with even more. So don't forget, if you just joined us, Cheryl Whitman Live with Dr. Roy here in Boca Raton, Florida. Welcome to the show. I'm very happy to see you, and I look forward to hear what you have to say about what is going on in the future as you see it for the women's sexual health and wellness, and for men as well. We can't forget about the men. Right. So I'm going to ask you, tell us a little bit about it. Tell us what you want to tell the audience and what they can learn.
Well, thanks for having me on, Cheryl, because I think that this conversation is very important. It's not only important to physicians to understand sexual wellness and the market that we have, but it's important for consumers. So any consumers that are watching to realize that we have some very progressive ways of treating sexual function. The conversation is interesting, however. It's my commitment to keep this conversation going and making it as interactive as is possible, because the problem of sexual dysfunction actually affects more than 50% of men and women.
That's an interesting number. You wouldn't think it was that high, and it has to be growing as we get older.
And that's really the issue. And as we are expecting a better life, we expect a better quality of life than our parents did. And so with the stresses of daily life, sexual function and intimacy is even more important than it ever was.
So how did you ever add this to your practice? How did you add all of these things to your functional medicine practice? And by the way, please ask us some questions, and we will be answering questions as we move along, and comments are absolutely welcome now and after the show. So how did you add this to your practice?
Well, I take care of a lot of patients. Hormones are really the draw to my practice, and in a time when not everybody was doing hormones, there's a real art and expertise to this. Every one of my patients answers questions about sexual function and just wellness in general. In my mind, sexual function is an integral part of wellness. Confidence, how you feel about yourself. Certainly your relationship is very much affected by your sexual function or even sexual confidence. So it ties into general wellness. So I always ask. And as I asked, I found that a lot of people have problems. And it's interesting, because when men have a problem with sexual function, they can't hide it. Everybody in the room knows about it, right? And it becomes a real big challenge. And the way men are wired, they absolutely need to satisfy their partner in order to feel confident, in order to feel like they've done their job. And so it's incredibly impactful when a man has a problem with sexual function or there's sexual changes. And function is not just getting and maintaining an erection. There are a lot of men who have pain with ejaculation, for instance, and we actually very successfully treat those problems, which most urologists don't realize what we're doing with platelet-rich plasma to treat those problems. With women, it's a bit more subtle. The change happens more slowly as we go through hormonal transitions. And we don't notice it as much. It's not as important because, you know, we can kind of get away with maybe not functioning optimally. So we don't run right into the doctor's office complaining about it quite typically. It's really an important part of the conversation, however, because I strongly believe that women, we have to step up as women, and we have to start to realize how important it is to our relationship. And
it's very true. I think most women don't know where to start the conversation, who to talk to. They talk to a girlfriend, they go to their OB/GYN practice, and if it's a very busy practice, they don't have time for them.
Right.
So it's really a question of how do you start the conversation in a practice or in an aesthetic practice. I think that the idea of adding hormones and anti-aging is great to a practice, and that's a great profit center. There's no question, and you absolutely are helping a lot of people. Then we were looking at what I saw at the aesthetic show, which was a lot of vaginal rejuvenation on the women's side. There was a full day, and Dr. Red Allensod was the moderator, and he teaches people how to start the conversation, which is really important. And so now, when it comes to vaginal rejuvenation and women's sexual health, women don't know where to go. There's many, many problems. What are the problems you're seeing? One of the things that I helped to launch was a ThermiVa, how to start the conversation in a practice. You know, people think even in a GYN practice that you could start the conversation so easily. You can't. You need to start with a questionnaire. You have to find out what it is that the patients are looking for, where they're having problems, so that sometimes will start the conversation in a practice. And how do you market to that niche market? So I think we should start going backwards with what do you see with vaginal rejuvenation as the future and what women should be looking forward to that's non-surgical, because honestly, we all want non-surgical if we can get away with it.
This is a very big conversation. There's a lot of facets to this. We could talk about this for weeks. And in fact, you know, I do some webinars. I'm going to continue to do webinars and invite people into this conversation, because every one of those questions you just asked are incredibly important, and you've got a revenue stream if you just follow any one of those questions down the path. And I'll tell you what I mean. I am so thrilled that you and ThermiVa are really doing such a great job getting that word out. You know, and it's interesting that people are drawn to aesthetics first. And in the case of female vaginal rejuvenation, it's because they don't understand what else we have. You know, too many years have gone by where women who even do go to their GYN or their family physician and talk about sexual changes, whether it's a decrease in libido or vaginal dryness or pain with intercourse or difficulty reaching orgasm, when they have that conversation and they are brave enough to have that conversation, most of the time they're met with very little as far as options for treatment.
That has always been the problem, that the options are surgical, and people want to stay away from what they've heard, these horror stories of surgery. Now, there's some surgical procedures that are wonderful, there's some doctors that are great, but we're all looking for non-surgical, quick and easy and fast with no downtime.
Right. Well, and the other part of that is a surgical vaginal rejuvenation doesn't necessarily regenerate any potential, doesn't improve vaginal dryness, doesn't improve sensitivity, doesn't improve any of that stuff. The ThermiVa actually does contribute to improving those issues because you truly are stimulating regeneration. And what I do with platelet-rich plasma works beautifully in conjunction with ThermiVa. It works beautifully alone as well if there isn't an aesthetic reason for rejuvenation, if it's more dryness or lack of sensitivity. I'll tell you, women, young women, often will have pain with intercourse, serious pain. And it's not associated with a hormonal imbalance. It's not associated with menopause. We've been talking mostly about menopausal women. Platelet-rich plasma is like magic for women who have pain with intercourse. The pain goes away in weeks. And Dr. Allensod and I have actually talked about this, how amazing it really is. And it's because we're regenerating. This regenerative medicine is a completely different way of thinking even. So we talk about men and women who have problems, and we want to solve their problems. We even have an opportunity to get more sophisticated than that, and that is to prevent problems.
And I think you having the solution is great. It would be wonderful if we can see some studies with the radio frequency and the PRP combinations. And, you know, with PRP, there's so many mixed reviews. Then we start hearing about stem cells. There's all different types of some stem cells, some better than others. People don't know which stem cells that they should be looking at. And interesting, I just had a friend just yesterday who went for the O shot. And she was nervous, she was upset, she was researching, and she really didn't find that much on the internet to give her that much information. She even called the practice that she was working with, and they didn't even have much information for her. They said, oh, we'll take your blood and we spin it, and it's called, you know, PRP. And so we're talking to an average patient, and we have educated consumers, as we talked about, and they're doing interesting things on the internet. But really, I think what you bring to the table for patients and with training of doctors is excellent, and it's so needed. Yeah. I think your book, and I am very excited to get a signed copy today, your sexual function book. I'm really interested to read it and to learn more. And for the audience, I know that they can go on to Amazon and pre-order it. So this is hot off the press, a brand new copy. And it will help, I think, not only patients, but it's going to help doctors. And I think it's time that we take some questions. Brenda, do you have the questions? I can't read them from so far away. I know that people want to know, how do we look better? How do we look younger? Where do we begin? Yes, it starts with aesthetics. We're looking in the mirror. We want to look better and feel better, have more self-confidence, self-esteem. But we also want to have better sexual function.
Yeah, we want to function better. And so a couple of things. Even physicians that are doing play-the-rich plasma, I realize, don't understand fully what they're doing with regard to the cellular components of play-the-rich plasma. They are great at doing the technique, a lot of competent physicians out there, but it's a relatively new technology in our mainstream medicine, and so there's a lot of science to it. If people want to go to join.studioprp.com, there's a webinar on that website, and it's an hour-long webinar talking about the actual science. A lot of people don't realize that how much science there is behind platelet-rich plasma. So we're working all of this out, but there is an ideal platelet-rich plasma that leads to more frequent benefit and better efficacy just in general.
And you have a very unique practice, because you have a practice of a lot of patients coming in for hormones. You do all type of aesthetics. So it's a natural evolution for you to get into women and men's sexual health and wellness. But some of the practices out there really don't know how to get into it and how to start it.
One of the great ways, I think, of starting this practice is come to training. So get training to actually offer the procedures. Again, that join.studioprp is a site where you can find the trainer to actually train you to do these procedures. I work with some urologists, some urogynecologists, other physicians who are interested in moving this forward because they've had great experience, and it's very exciting when you can help people. So there's training opportunities at that website. All of those trainers use the best equipment. So we're going to do a webinar in a couple of weeks about training, you know, where to get your training and why to choose one place over another. And it's really just educating. There's so many opportunities for training out there, but they're not all great experiences. You have to understand the agenda. My agenda is to advance the use of platelet-rich plasma to help people. And so the way to do that is to get the best results. So if you learn how to do the techniques, at my training anyway, I share with you a lot of adjunctive therapies, simple compounds that you can prescribe for patients to help, little fast track tricks to help people get their libido on board.
And do you recommend any stem cell product that you recommend for women to use? I was just at the aesthetic show, and every other booth has a product to use. Of course, every salesman tells you that their stuff is the best, and there's obviously lasers out there. I don't particularly care for the downtime when I hear about the downtime, and I hear about some of the negatives. Yeah. So I really do like the radio frequency and the fact that you can go home and have sex that night. I like the fact that there is no downtime, and the provider cannot hurt you, and you don't have to worry that, and it is safe. There's no question about it. So I think we should take a question now. But how do you decide which treatments, this is from Glenn, and I thank you, Glenn, for this, but how do you decide which type of treatments are good fit to add to your practice?
Well, number one, I want to make sure it generates revenue. Okay, that's
I'm in agreement
important.
with that.
Yeah, you got to make sure it generates revenue. So I run it through my business model, then I run it through my ethics. If it doesn't pass my business model, it doesn't even need to go to the ethics. If it passes the business model, then I have to think: is this safe? Is this reasonable? Is this effective? Is there any science behind this? And so, Play the Rich Plasma is a real winner on every one of those fronts. I think you add Play the Rich Plasma, and one of the big reasons that should go first is because it's an amazing tool that you can use if you're a family physician, or you can inject joints with it. If you do aesthetics, you can use it with your lasers, you can use it as a standalone. We use Play the Rich Plasma for women who have urinary incontinence. Works incredibly well.
How many treatments do they need if they come in for something like that?
It depends. Usually women are very easy to fix. One treatment is usually what we get for women. And
that's great results.
It's wonderful results. Men are a little bit more difficult, and it depends on the degree of dysfunction.
Well, they are anyway, but that's okay. Yeah, that's another story. That's another webinar.
That's right. But there's so many uses. I mean, we use Play the Rich Plasma to stimulate hair growth. I have urologists who are using Play the Rich Plasma to stimulate hair growth. And the reason is because I've taught them how to do these procedures in their practice. They have huge practices, lots of men coming in.
Right.
Hair and sexual function is number one and number two for men as well as women. And so it took them a while to embrace this idea. Urologists are used to taking insurance for everything.
Absolutely.
They're not used to these gimmicky things. Well, what they realized is Play the Rich Plasma is not gimmicky. If you're using the right Play the Rich Plasma and you're doing the right procedures and techniques, you're getting such great results. They're standing there with this tool saying, wow, how many different ways can I use this? The hair restoration is a natural progression for them.
Absolutely.
It's an easy procedure to do. So it's one of those tools that you really can't be without. I barely do anything anymore without incorporating Play the Rich Plasma in. And again, the ThermiVa, I absolutely believe, is the best vaginal rejuvenation technology that's there. When you combine it with the Play the Rich Plasma, it's a synergistic type of regeneration. And again, no downtime. So whether you're doing just Play the Rich Plasma, just ThermiVa, or the combination of the two, as soon as you leave my office, you can have sex. That's pretty much how I answer that question.
I think we'll have to add some extra bedrooms on the side here. But it's interesting because the medical director, Dr. Red Allenside, that we both know, we have in common as he is Thermi's medical director. And so he's always talking about starting the conversation in your practice. How do you market it? Well, one of the things we did as a consulting firm is we actually started to do little VIP events, small events, just intimate events, start with 5 or 10 people. And those little events will also get you launched into talking about it, getting your staff educated. That is the first thing you need to do, is educate your staff. You can be the best doctor, know everything, but if your staff doesn't stand behind you, they don't know when they're answering the phones what to answer, how to book an appointment, when you're doing a consult, if it's not you and it's somebody else. It's really important the staff is educated first, and you might even do some tests and trials on your staff, because they're your best patients, and they will give you the testimonials you'll need to get more patients. So people say, how do I market? Start internally. Start with your internal database. Start with email blasts. Start with having small, intimate events, wine and cheese, women's tea, women's lunches, happy hours.
So many opportunities. What we do as part of the training here, I have a training here once a month, and as I mentioned, we have other physicians that train as well. We encourage doctors to bring their staff to the training.
That's great.
Because we want you to understand the science. An educated consumer is our best consumer, because we're doing the best stuff ever. We know our stuff. So we want your staff to understand it. We also want your staff to experience it. So every one of my team has had these procedures. And the physicians that bring their staff, when the staff's had the procedure and they go home and they've had benefit, it's a huge deal. Even sometimes we'll have some younger women or men that are staff members that don't necessarily have problems, just going through the process of having the procedures, O-shot and Priapus shot for instance, the sexual medicine procedures. there's a lot of anxiety associated with needles in tender places. Well, when your staff has had the procedure and they can talk a patient through it and help them understand this is not a big deal at all, it's not uncomfortable, it's very tolerable, and really help them understand what to expect, there's so much more confidence then that the potential patient has in the practice in general. And it all starts with who's answering the phone, right? And then when they come through the door and there's a consistent message. I've made YouTube videos, which have been the most beneficial marketing tool. Just
That's
me
great.
standing with my hair all messed up, and it didn't have to be perfect, and I pushed record and just said what I needed to say to patients and educate them. They've been watched tens of thousands of times, and people fly in from all over the country here to my practice because they feel like they've met me on YouTube. So that's a big
Which
deal.
is great. That's why we're doing live, because if you stay tuned to live, you will learn so much, and we're going to do this on a weekly basis, and we'll have to do it long distance if I'm traveling, because I plan to take this on the road. And I think we should take another question. Adriana, thank you for your question. I'm a potential patient and I'm experiencing painful intercourse. Are there any contradictions if I'm trying to conceive and get pregnant? And that's great, Adriana. Keep us posted on that.
No contraindications at all. None. There's no safety issue. There is absolutely no negative that I could think of at all. Now, certainly if a woman were pregnant, it wouldn't be the time to do it, not because platelet-rich plasma is going to interfere, but you want to get out of the way of that process.
Do you do a pregnancy test if it's a woman in her early 30s?
No, I don't. I don't, because I'm not worried about the risk. If it's just like Botox, right? Would I do a pregnancy test on every woman of reproductive age?
You'd be very busy.
So I don't do that.
Okay.
If we know that she's pregnant, we might talk about a different option.
Okay.
But not for any reason other than you want to stay away from that process. Right?
What percentage of men versus women are in your practice on a daily basis overall?
I probably have a 30% male, 70% female practice, and I have more and more men coming in every day. More and more men. I think that that's important to realize, not only in sexual medicine, but also aesthetics and hormone balancing and all of these things that add value and quality to life. Men are wanting these as well, and they're seeking care. And so I would encourage you to have your practice very gender neutral, if that's what you're open to. I have GYNs who are treating men now as well. Hormonally, I have urologists who typically have male practices that are treating women. In fact, there's a urologist in Miami, Paul Perito, one of the busiest urologists in the country. He only treats men. We taught him how to do these procedures. He's over the moon excited about these procedures, and now he puts in more penile implants than anybody in the world.
Wow.
With every penile implant, he is offering the partner O-shot for female sexual wellness.
That's funny. You
That's
get one,
amazing.
you buy one, you get one free, you get one half price. That's a good marketing tool.
He's just so excited about it. He said, well, you know what, I fixed the guy, and sure, their partner probably has some issue. We're all getting older, or wants. That's the cool thing about this market. 50% have an actual problem. The other 50% want better sex.
And
Pretty big
100% of them are taking Viagra and Levitra and everything else that's out there,
Right.
and they don't know that there's an option. So now we have an option. We have to get the word out. And maybe when we talk about these events, we do some small events for women. We do some small events just for men. And sometimes I like to segment them in age groups, because the 30-year-olds don't really care about the 60-year-olds. Everybody's thinking about something different at that point in their life. And I think that start to have some men's events.
Right.
I don't care if you have cigar rolling or, Ferrari cars that they could, have a drawing for, and they can have it for a weekend
That's
to
for the
draw
women,
them
right?
in.
That's for the women, right? I wanna
Absolutely,
go
the
that
men
way.
and the women. So I think that you have to come up with creative ideas to draw people into your practice. And I love the idea of what you said, where, he wants to, the doctor in Miami, get women into his practice as well, because the industry standard, the max at this point in the aesthetic, is 20% men in the market,
Yeah.
in And it's growing. We see it's growing. I'm really happy to hear that you have 30% and that's growing.
Yeah, at least.
Because, you know, if we have women out there that are happy, we need happy men out there.
Yeah.
We're all getting older. We all want to look younger and we're working longer. So everybody really has to equally understand. A lot of the time, the women are drawing the men into the practice, or they're saying, why don't you go see this doctor? It's the same thing with hair restoration. Honey, you're losing your hair, you have balding. You know, I think it was Merck Pharmaceutical did a study years ago. It took a man 7 years until they realized that they had to go, and he had to go and get hair transplants, or at least go for a consult and talk to a doctor, or start Rogaine, or start Propecia, or whatever it was he was going to start. So it takes men much longer to realize and to be able to go ask. And I think that
Not
that's
when it
a
comes to
Venus
sexual
and Mars
function.
thing.
Yeah, not when it comes to sexual function. I mean, they're flying in
Yeah.
from everywhere. And you know, one of the things we do in the training, we provide you, physicians that come for training, we provide you brochures.
Right.
For instance, we provide you a waiting room loop. The waiting room loop that you see here is very nicely done. We provide that to you so that you have this turnkey. We provide you with a seminar in a box, we call it, which is a PowerPoint presentation and all the tools you need to present these options to your patients, because that's the gold mine. When you have a database of patients that already trust you and they already like you and know you and have faith in what you're doing, when you introduce these types of procedures or these types of treatment options, they're very receptive. Very receptive.
Absolutely. It is very important to start internal marketing. As a matter of fact, in my book, Beautifully Profitable, Profitable Forever, which you also can find on Amazon, or it has its own website, there is a code, LIVE, L-I-V-E, it's a discount code. If you go onto the Beautifully Profitable website, the 5th edition is about to come out any day now. We have lots of information here on marketing, internal, external marketing, because you're giving the doctors what they need to work with the patients, but we help to bring the patients in the door. How do we get them in? How do we teach them? So you're doing one end of it, we're doing the other. So it's a very interesting combination of what we're talking about. So I think we should probably take another question now, and we just have to find them and be able to see them. Okay, I need help with the questions. So I don't see them on mine, but I guess we have it here. Okay, so how can I find a doctor of the caliber if I live in New Jersey? That's a good question. Thank you for that question.
Yeah.
Oh, come on, you have the answers to everything.
Yeah, that one's a really tricky one, because so here's the thing. There are doctors doing these procedures under the trademark O-shot and Priapus shot. There are doctors who are not using those trademark names who are doing the procedures. I know that you can go to oshot.info, I believe it is, and priapusshot.com and find some providers. But here's the thing. They know how to do the procedure, but you don't know what kind of PRP they're spinning. If you go to studioprp.com, you're going to see physicians who use the best equipment, that follow the science, that also, you know how to do the procedures. So I hate to say it, but the only true source that I know of is studioprp.com. I do have a lot of people that fly in for that reason. You know, it's hard to know who's doing what. There's a lot of snake oil, and I don't know that in this particular case anybody is doing that intentionally. You know, there's just a lack of knowledge, I think, that is sorely affecting us. And that's where I really have a passion for educating and raising the standards. And when we do these kind of webinars, these scientific webinars, we have hundreds of doctors that sign on because they really do want to know. They really truly are trying to offer the consumer the best treatment possible. Nobody's out there, you know, otherwise. But the lack of knowledge, I think, is what gets in the way of a consistent, good result.
And that's very true. I think that most patients know to look up testimonials, go on the website, go on to Real Self. They usually have some very good health grades, has good ratings, because you want to really know about the doctor that's being, and you want to see their testimonials. You want to see what other people are saying about them. So that will give you one idea before you even walk in the door. You want to look at their credentials. You want to find out how long they're actually doing the procedures.
Call their office and see if somebody's willing to talk to you. What I always do, always have a telephone call with a patient who's flying in. Because what I don't want to have happen is have a patient fly in where this isn't their best option. Okay, and I believe that this is an option for most people, but I want to know a little bit more about you so that I can properly prepare you even for this option. I want the visit here to my office to be outstanding and have you feel like you were served. And so I think physicians should offer that to people. My staff will say, hey, why don't we get you on the phone, a quick 15-minute call with Dr. Roy, and that way all your questions can be answered and we get to know each other a little bit.
And that's great that you even offer that consulting help. Do you charge for consultations?
What we do, and this works very well in our practice, we charge $150 for that call, which will be credited back to you when you come in for the procedure. And it's really just, it's not because I care about the patient's $150. It's just there's a certain qualifier. Are you willing to pay $150 to have your questions answered? Well, if you are, then you're probably somebody who's serious about this. Otherwise, I could spend the whole day on the phone talking about it.
Oh, absolutely. Do you ever think of doing this on Facebook Live or on doing this, you know, and being able to do telemedicine where you can sit and talk to patients? I mean, that's the wave of the future.
I do a lot on the phone and a lot on Skype. And that works really very well for the consultation for this type of service. I don't need them sitting in front of me to actually do that type of consultation. So I think when you call a doctor, they should be willing to do that. That's another way of vetting, if you will, an appropriately concerned practice.
And I'm very impressed not only with you and the way that you want to educate and the way you want to educate the doctors, and then you want to educate the patients. So you're on both sides, which is great.
Yeah.
The other thing I'm very impressed with is that you mentioned earlier, and I'm going to go back to this because as a consultant, we deal with, okay, let's create new profit centers. Let's create a business plan. Let's create performers. Let's create, how are you going to make money? How many rooms do you have? How many hours do we have in a day? We all need more days. We all need more hours. But I like the fact that you would take a profit center, whether it's a piece of equipment or the PRP, look at it very closely, break it down and figure out how much money am I going to make? Is this worth it to bring it into my practice? Do I have the right demographics? Maybe you need to survey or do focus groups with your patients to figure out before you take on something new if you feel maybe it's not for your practice, maybe it's not great in the middle of, you know, the countryside. I don't want to say where, I don't want to hurt anybody's feelings.
They're flying to me.
Okay, well that's great. At least you come down to sunny South Florida, it's great. This time of the year it's a little warm, but otherwise it's beautiful. And I am really happy that we spend time together. And how could people find you and ask you some more questions? Maybe you want to give them some information about that.
Sure. Drstudio.com, all spelled out. Drstudio.com is my practice website. StudioPRP.com is a website where you can go to find providers that I've trained that use the equipment that we advocate for, and also learn a little bit more in detail about some of these procedures. If you're a physician, join.studioprp.com is the training website where you can get some training information. And what's up? And Facebook. Dr. Studio has
we're on Facebook right now. Facebook Live.
That's right. And if you email me, my personal email address is drroy, DRROY, at doctorsstudio.com. I'm more than happy to answer any questions that you have, direct you to the right place, whether you're a consumer or a physician. And come to our training if you're a physician, and you can get to see all the ways in which we're using some of these tools, not just for sexual medicine, though that's sort of my passion, but platelet-rich plasma in many, many different ways. And we can work together to collaborate to make these things as good as they can be for everybody.
That's great, because everybody wants to look younger and feel younger. So I want you to keep following us. Stay live with us every Wednesday. In between, I might surprise you on my road trip to Boston and back. But I look forward to seeing you again next Wednesday on the Facebook Live. Any questions for Cheryl at beautifulforever.com. And we look forward to seeing you. And thank you for joining us again. And thank you very much for your time. It was terrific. It was really great.
I enjoyed it. One last thing, just email me if you want to be invited to the webinars that we're going to do in the future so you can stay.
That's great. Am I invited?
We'll put you on
Okay, I'm on the list. Okay, have a great day, everybody, and thank you. Keep the questions and comments coming in. We will get to all of them, and I look forward to seeing you. Press your follow button so you'll know when I'm live and you'll get notification. Have a wonderful day.
Thank you.